Hi, everybody. I'm Tanikka Price, Chief Education and Equity Officer for HIO, Health Impact Ohio. And I am so happy to be here today. This is one of those full circle moments. I am actually going to be interviewing my mentor, Vivian Jackson Anderson. And I was thinking today about how we met. We actually met after she spoke at an event at CPH. And I saw so much of my future self in her. And I went up to talk to her afterwards about the fact that we both had twins. We had so many similar interests, so much of a similar past. And so now getting to work with her is just an amazing experience. I will let her introduce herself. Ms. Jackson Anderson, please introduce yourself.
Oh, I feel so honored. My name is Vivian Jackson Anderson, and I am the current president of the National Council of Negro Women, the Columbus section, and that's an honor as well.
So just to get us started, can you share a little bit about your current work at your organization? Tell us about what you are doing now.
Well, I am retired, and I worked for 40 plus years at the Ohio Department of Health in the Bureau of Maternal and Child Health. And I also worked for the Ohio State University prior to that. And then I moved to the Ohio Department of Health. And so I there was a manager over or an administrator over a program for community health workers. I went in as a speech and language pathologist, and that's my profession. That's what I went to school to be, a speech and language pathologist, and work with aphasic patients. But upon retiring, I thought I would get a chance to rest, and people were saying, "Can I call you to be on this? Will you be on this committee?" I said, "Just give me," I think I told them 6 months. And I said, then get in touch with me about serving. But I was always a member of the National Council of Negro Women and, worked in various positions, just doing things in that organization. And the organization was founded by Dr. Mary McLeod Bethune in 1935. And it's just a very honorable type organization. And so I received a call one night asking me if I would serve as an officer. And I hadn't served as an officer at all. I was a helper. If there was a hole, I filled it. If there was something that needed to be done, I did it. And when they said president, I said, president. And I talked with my husband about it. And he said, if you want to do it. Now he says, I think NCNW 24/7. And he may be right. But the mission of the organization is to lead, empower, and advocate for women of African descent, their families, and communities. And as such, we do community-based services. And in working with other organizations, we partner. So we've worked with COVID-19 since it started, getting people educated and getting people encouraging their vaccination if that's what they chose to do. We do something called a diaper drive every year where we help, we collect, last year we collected over 10,000 diapers and about 11,000 wipes, I believe. And we choose a couple of organizations that work with expectant moms and give those diapers, to them. And we do quite a bit during the holidays. This year, we worked with Miracle on Long Street. We also worked with Mary Haven, and we also gave some holiday items to family, children and family services. What's that correct name?
Ohio Job and Family Services.
Yes, and we gave 100 different items at least to them. So it's a community-based organization that do things that way. And we are going to be moving into working with drugs and opiate, doing some education where that's concerned. And what we're excited about right now too is we work with uh, with a woman whose name is Fran Frazier, who is involved in the community, and she's always been concerned about girls. And she came to one of our annual events and a luncheon, and she was impressed and became a member. And so we are working on a campaign called Love Letters to Black Girls. It's Black Girls Rising, and doing that as well. And we are also in one of the schools where we have a girls group in the Afrocentric school. So that's some of what we do. I'm sure I'm missing some things. And so I have the joy of leading women and allowing them to move in their interest, allowing them to move in what they desire to do to help the community. And of course, we are doing community health work, and that's that circle that Dr. T and was talking about, because before I managed 13 programs around the state that had in cities where infant mortality was the worst. That disparity was unacceptable.
Yeah, well, you know a little bit about what brought me to community health work. And part of what our similar stories were is that I was trained as an attorney prior to giving birth to 2-pound, 3-ounce twins. And I didn't know anything about infant mortality or maternal mortality or racial health disparities. I had never heard those terms. And I thought if I could be this educated and be a Black female in Franklin County, where the infant mortality is almost the highest in the country, and I don't know this, then nobody knows it. And so that's what started my health education career path that led me to where I am today. I honestly don't know how you got from being a speech language pathologist to being a community health worker. So can you share that journey with us?
Okay. Well, as I said, I was hired by, I am a speech language pathologist, and I was hired by the Ohio State University to work on an international program, a project they had. We were working with a program in Italy where it was about aphasics, and those are individuals who have had an accident, and if it wasn't an accident, it may just been a stroke, not just a stroke, that caused them to have an inability to communicate in totally. And so I did that, I loved that, and was intricately a part of that, and thought that's what I would do for the rest of my life. And one of my supervisors, that the administrator that I remember the most, name was Diana Dale, at the Ohio Department of Health, came, and we did a lot of talking, and she knew how I felt about things that had happened early in our lives in the 60s and the 70s and the 80s, and we bonded there. And she said, Vivian, I think, we have a program, and I knew about it, but somebody else was doing it at the time, that you would be interested in doing. And because this individual was leaving, and she said, what about the Ohio Infant Mortality Reduction Initiative program? And I curtly responded, I don't want to do a program working with dead babies, is what I said. And she said, well, think about it. And I didn't have to think long. I thought about it. I looked into the program, and I knew that that was the reason that this little girl had come from Springfield, Georgia, by way of Norfolk for an education, to Ohio State to get a master's, to end up at the Ohio Department of Health. That was why I was on this earth. And so I started with that in the program. And I mentioned recently that I stayed 10 years longer than I needed to at the Ohio Department of Health, because the community health workers wanted me to stay, for one, and I wanted to stay. But I thought last night when I got home, it was the community health workers because I bonded, but it was also the supervisors, because they saw me as an advocate for them at the Ohio Department of Health. They because I was the one that they called, and so we had grants, and I reviewed their grants and for funding, but we had a very good relationship, because this wasn't easy, and trying to do manage a program where you're looking at African American babies. Ohio isn't the most non-racist state in the country. And I'll stop with that point. But they needed me and I needed them. Now, half of my supervisors were European American or white. And what we required is that the community health workers came from the communities where they were providing service. So, and when we started doing that, there was some pushback. You're saying we can't hire who we want to hire. And I said, they're going to try and get individuals and to enroll them. And there is a trust factor, and there is a bridge building factor. And if you want to get in the door, you have to be trusted, or somebody have to say that I know them and they're all right. And I had one supervisor in Springfield. Her name was Diane Van Acker, and she hired some of the best white or European American community health workers that we had. And I said, if I could clone Diana, it would be fine. I know you would hire the right person. And I'm not saying just because a person's skin is like mine or darker, that they are the best, but they go in at least looking like the individuals they served. And so that's kind of the journey. That's how I got there. And I traveled around the state. One of the things I did a lot was get out of the office, because I couldn't meet the individuals that were serving the individuals. So I would go on site visits, and and part of my site visit was going to a home, going on a visit with them. And I was able to learn from community health workers so that I could be their advocate with their supervisor, even of saying, okay, you want them back by a certain time, but it's true. They went in that house, and it was not only was this going on, or were they going there to help that young woman or older woman who was pregnant, but she talked about not having food, or she talked about maybe being evicted. And before we could get to the baby, we had to deal with the eviction. So it was getting that kind of knowledge that was helpful. So that's part of the journey.
Well, thank you for sharing that. My last question is about February. We are highlighting you in part because of Black History Month. And I just wanted you to speak a little bit about how your organization continues to be relevant in today's society, and then whether or not you think sharing Black history, celebrating Black history remains relevant in 2023.
I'm going to start with the last question. I definitely think sharing Black history is relevant in 2023. At my age, as I said, I grew up in Georgia, and I can remember once we had the right to go into a library. I always loved books. I learned to cook much later in life because I was behind the bed reading a book. And I always wanted to go to the library, and I couldn't go. And so when I was able to go, when the laws changed and I was able to go, I drove to the library. I didn't tell my parents I was going. And because I didn't know whether they would want me to go because of racism that existed. I'd already was one of the students that was supposed to integrate the schools. There were 3 of us that were supposed to integrate when integration was permitted. But I went up to that library and I went in, and as I went in the door, the folk in there began to look at me because they, I think, had never seen a little Black girl walk into a library. And so they asked me, that library, and so they asked me my name, and I gave it to them. And who are your parents? And I gave it to them. And and they didn't know my father's name, but then they said, well, who are your grandparents? And when I told them my grandparents' name, because the county is little and the town was little, they knew my granddaddy. And I was allowed to be in the library that day and to look at books that day. On another instance, I was chosen when I was in 3rd grade to be the queen of the school. And we only had 1 car, and my father had to drive it to work. And so my mother and I went out and we caught the Greyhound, was going to catch the Greyhound bus to go to Savannah, Georgia, to get me a pretty dress. And I'd never been on a bus before. And I got on that bus and I sat in the first seat I got to, which was behind the bus driver. My mother caught me by the shoulders and in a very hurtful grip, took me to the back of the bus. And she didn't explain it because of fear at the time. I mean, she didn't explain why I couldn't sit in the seat of my choice. And later on in life, it became, I knew, and that trip was tainted by that event. I think our boys and girls, I think folk who haven't had those kinds of experiences need to know how they have the privileges they have today. And one of those women who did that and helped with that is Dr. Mary McLeod Bethune and our organization. Here was a woman who was an educator. She started a school for girls with $1.50. And that was probably a lot of money back then. But as we think about it, $1.50. And in our organization, I had the idea of developing a scholarship fund because our founder was such an educator, and we call it Be the Change, because I wanted our members to just bring the change that they had that from 1 month to another, just save your change and bring it. And we are going to start a scholarship fund with change. And so we gave our first scholarship out last year. So that's why we are scholarships. And we're giving scholarships out this year as well. So that's why we're still a viable organization, because of Dr. Bethune and providing leadership. And we still champion civil and human rights with the program that I mentioned earlier, in Love Letters to Black Girls, with a young lady being killed in Columbus. It's a human right to be able to inhale and exhale, to be able to live. So this was a young lady who was not able to do that. So with this program, we are saying to girls, we hear you, we love you, and we see you. And we bring girls together and read these love letters that have been written by women across the greater Columbus area from their hearts, saying, we care. And we also have a program where we send glasses to Africa. And we also bring there is a program that where prescription bottles are needed. And so we have literally collected hundreds and hundreds of prescription bottles, and they have been sent to Africa as well. So we work here, and we not only should we be mindful of individuals like Dr. Bethune and others who came before us, we are making history as well every day. And so in years to come, hopefully others will see what we've done and do some of the same. But what's more important is to do more for another brother, a sister, a child. Black history is important.